Bismillahirrahmanirrahim. A smart person knows what to say, and a wise person knows whether or not to say it. Today, my topic of presentation is dengue. Learning outlines are the introduction of dengue, its history, epidemiological triad, chain of transmission, clinical features, level of prevention, and recent advances. At the end of this session, my colleagues will have the understanding of dengue, its epidemiological triad, and the recent advances. What is dengue? Dengue is an infectious tropical disease caused by the dengue virus, which is also known as the breakbone fever. This disease was first described in 1780s and the virus was isolated by Sabin in 1944. Dengue virus infection is the most common arthropod-borne disease worldwide with an increasing incidence in the tropical regions of Asia, Africa, Central and South America. There are four serotypes of the virus. All are transmitted by mosquitoes, which are not affected by the disease, although an infected mosquito may infect others. The first case of dengue fever was detected in Pakistan in the year 1994 in Karachi. The first outbreak of dengue virus in Pakistan was in the year 2006. Since then, the dengue cases detected per year are on the rise. The problem statement, new infections occur annually are 50 to 100 million people, and the deaths are 25,000 annually. People at risk are 2.5 to 3 billion, and the hospitalized cases 5 lakh per million. 90% of those affected are children. Disease burden are 4 lakh 65,000 disability adjusted life years. Half of the world lives in the hot zone. Epidemiological triad, agent, host, and environmental factors. Agent. Dengue virus is an arbovirus related to the flavivirus family, small enveloped viruses containing single-stranded RNA. It has four distinct virus serotypes, dengue 1, 2, 3, and 4. Host factors, the peak age group which are infected with the dengue virus is 5 to 9 years, and it is equally susceptible in all genders. The patient who are infected with the dengue virus may have the acquired immunity for temporary time period. Environmental factors, it is sporadic throughout the year. Epidemic usually occurs during the raining seasons, June to November. Peak months are September and October. Transmission, it is transmitted by the infective bite of the female Aedes aegypti mosquito. The mosquito ingests the blood with the dengue virus and takes 8 to 10 days for the dengue to incubate. Dengue virus infected mosquito bites the normal person and the infected person gets the dengue in 4 to 13 days. Here are a few common breeding places of the Aedes aegypti mosquito, like the natural and the artificial water reservoirs, water tanks, tires, and water preserving utensils. Incubation period. Dengue virus infection has an incubation period of about 3 to 14 days, and the acute illness and viremia occurs in 3 to 7 days. Period of communicability presumed to be on the first week of the illness when the virus is still present in the blood. Pathophysiology of dengue virus infection. It causes the two mechanisms like the increased vascular permeability, which leads to plasma leakage, hypovolemia, and shock. On the other hand, it leads to decreased platelet count, causing coagulability, disseminated intravascular coagulation, severe bleeding. All of these leads to death. Clinical cause of the dengue virus infection, patient presenting may be asymptomatic or undifferentiated febrile illness, dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. All these clinical cause, there are three phases: febrile phase, critical phase, and the recovery phase. Patient in the febrile phase presented with sudden onset fever, headache, nose and mouth bleeding, muscles and joints pain, vomiting, diarrhea, rash. And in the critical phase, it presents with hypertension, pleural effusion, ascites, GIT bleeding. In the recovery phase, there are altered level of consciousness, seizures, and itching, slow heart rate. Other complications with the dengue virus infections are shock, encephalopathy, residual brain damage, seizures, and liver damage. Now, the levels of prevention. Primary prevention consists of health promotion and specific protection. In health promotion, we focus on educating the people about the how to control the vector, use mosquito nets, sprays, repellent oils, drain the stagnant water sites, wear full clothes at dawn and dusk, and the fumigation. Prevention is further divided into four categories: personal, environmental, biological, and the chemical. Personal consists of clothing to reduce the exposed skin, insect repellents, especially in the early morning, late afternoon. Bed netting is important, mosquito repellents, coils, and the sanitation measures. And the environmental factors to reduce the vector breeding sites, solid waste management, public education, empty water containers, and cut weeds and tall grass. Biological consists of targeting the larval stage of the Aedes aegypti mosquito in the large water storage containers, larvivorous fishes, endotoxin-producing bacteria, and the copepod crustaceans. And the chemical consists of thermofogging malathion, insecticide treatment of water containers, space spraying, indoor space spraying, and organophosphorus compounds. Here are some precautionary measures which is published by the government of Pakistan to how to prevent the dengue virus. Now the vaccine, the world's first dengue vaccines, dengue vaccine, developed by the Sanofi Pasteur was approved for the use in Mexico, Philippines, and the Brazil in December 2015 for the prevention of deadly mosquito-borne disease in people living in the dengue endemic areas. There are some new dengue vaccines which are developed by the National Institute of Allergy and Infectious Diseases. And another vaccine developed by the Takeda called the tetravalent dengue vaccine has also entered the phase 3 trials early in the 2016 in the Latin America and Asia. Secondary prevention, which consists of early diagnosis and the prompt treatment. There are different diagnostic tests for the dengue virus. Number one is the hemagglutination inhibition test, complement fixation test, neutralization test, IgM capture as enzyme linked immunosorbent assays, IgG ELISA, and the rapid diagnostic tests. Interpretation of diagnostic tests, the tests which are highly suggestive, which should be positive, one of the following: IgM positive in a single serum sample, or the IgG in a single serum sample with the HI titer of 1280 or greater. And the confirmed diagnostic says one of the following should be positive: PCR, virus culture, IgM seroconversion in pair sera, and the IgG seroconversion in pair sera, or fourfold IgG titer increase in pair sera. How to interpret the dengue serology? If the patient presented to you with the serological test of the dengue virus and IgG and IgM both are negative, the interpretation are that it may be early sample or not the dengue virus. And if the patient is having the IgG positive but having low titer, it represents that it has the past dengue infection. And the patient having only IgG positive with a high titer level, it may represent that it has a secondary dengue infection. Patient presented with having only IgM positive, the interpretation are the primary dengue infection. If the patient having both IgG and IgM positive, but the titer level are different, if patient present with a low IgG titer, then it is a recent primary dengue infection. But if the patient having the high titer level of the IgG, then we differentiate on these two bases, having IgG low titer or high titer. And it is, if having the patient is having the positive IgG and high titer, then it is a secondary dengue infection. And if patient is having the low titer of IgG, then it is a recent primary dengue infection. Now the treatment options: sportive measures, fluid resuscitation, crystalloids and colloids, blood component therapy like PETs, RBCs, fresh frozen plasma, cryoprecipitates, platelet concentrates, and the oxygen therapy, inotropic drugs, dopamine, dobutamine, epinephrine, norepinephrine, and milrinone. Fight dengue with these simple diet tips: consume protein rich food, increase your water intake, eat more of the green leafy vegetables, eat easily digestible foods, having more of the fresh fruits, drink juices extracted from the papaya leaves. Tertiary prevention, it consists of effective management to prevent the complications and death. Dengue control programs in the Pakistan, WHO is providing technical assistance to the government to combat the epidemic. This includes providing standard guidelines and capacity building in the planning and implementation of prevention and control measures. The three main areas of focus are vector control, case management, and community awareness. Since 2010, Pakistan has been experiencing an epidemic of dengue virus fever that has occurred 16,580 confirmed cases and 257 deaths in Lahore, and nearly 5,000 cases and 60 deaths reported from the rest of the country. The three main provinces facing the epidemic are Khyber Pakhtunkhwa, Punjab, and Sindh. Epidemics Prevention and Control Program. Government started multiple activities, but there was lack of the comprehensive rules and responsibilities. To meet this deficiency, Department of the Health Education developed a plan with the name of Prevention and Control Program of Epidemics in Punjab. The main components of the program are disease and vector surveillance, health education, communication, social mobilization and advocacy, institutional and capacity building, research and development. Is a research article on the broad dengue neutralization in mosquitoes expressing an engineered antibody. Recent advances in the genetic engineering technology have made it possible to create mosquitoes with a reduced vector competence, which limits its ability to acquire and transmit the pathogen. In this study, there is a development of the Aedes aegypti mosquitoes synthetically engineered to impede the vector competence to dengue virus infection. These mosquitoes express a gene encoding an engineered single chain variable fragment derived from a broadly neutralizing dengue virus human monoclonal antibody and significantly reduce the viral infection dissemination and transmission rates for all four major antigenically distant serotypes of the dengue virus. Dengue virus, non-structural protein 1, triggers the endothelial permeability and vascular leakage that is prevented by the NS1 vaccination. In this research article, there is inoculation of mice with dengue virus non-structural protein 1, in which induce both the leakage, vascular leakage, and the production of key inflammatory cytokines. Furthermore, the simultaneous administration of NS1 with a sublethal dose of dengue virus 2 result in a lethal vascular leak syndrome. These findings add an important and previously overlooked component of the causes of dengue vascular leakage, identifying a new potential target for the dengue therapeutics and supports the inoculation of NS1 in the dengue vaccines. Molecular imprinted polymer based epidemiologic sensor for detecting the dengue fever biomarker. The developed center selectively detects the non-structural protein 1 concentrations as low as to 0.3 nanogram per ml. The epidemiologic center system also employed for NS1 determination in real human serum samples, satisfying the recoveries varying from 95 to 97%. 14% were obtained with a standard deviation of less than 5%. There is a study carried out in the Pakistan for quantifying the localized relationship between the vector contaminant activities and the dengue incidence in the real world settings. This study shows a result that 10% and 20% reduction in probability of case occurring in 50 meters and 30 days of the cases, which are indoor residual spraying and fogging, were performed in the immediate vicinity respectively, compared to the cases of similar epidemiological contexts and which had no contaminant in their vicinity. Now there's a research article on the quantitative and selective surface plasmon resonance, which act as a sensor to show us sensitive and selective response towards the dengue virus 2E proteins for its detection, and it is more sensitive for the dengue virus A as compared to 1 and Zika virus. Overall, in this research article, it was concluded that the thin film-based SPR sensors have the potential to serve as a rapid clinical diagnostic tool for the dengue virus infection. Now, the latest trend of the dengue virus in the Pakistan, the November 2019, a total of 47,120 confirmed cases of dengue virus fever, including 75 deaths were reported from the 4 provinces of Pakistan. The global trend shows that the number of dengue cases reported to WHO increased over 8-fold over the last 2 decades, from 5,0430 cases in 2000 to the 2.4 million cases in 2010 and 4.2 million cases in 2019. Reported deaths between the year 2000 and 2015 increased from 960 to 4,032 cases. Here are the references of this presentation. Now the MCQ section. According to the WHO estimate, how many cases of dengue virus infections occur annually?
A.
100 million.
Worst case scenario for dengue?
A.
Shock.
A. Shock.
Where did dengue originated? In China,
D.
France,
D. Africa. C.
Ancient Africa. D. C.
C. Aedes mosquito.
dengue fever incubation period
B.
range from
C.
B.
3 to 14 days. In 2016, which vaccine entered its phase 3 trial in the Latin America? Tetravalent dengue vaccine, conjugated vaccine, toxoid, or the protein?
C.
It's tetravalent dengue. A patient tested for the dengue virus
C. B. B. Primary.
Primary. B.
the first outbreak of the dengue virus.
A.
The world's first dengue vaccine was developed by
A.
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 how many days dengue virus incubates in the moisture?
A. A to 10.
Here is the key. Thank you so much.
Thank you, Dr. Maida, for the extensive presentation. As we know that dengue is a mosquito-borne infection with 4 serotypes, and the best way of management is by WHO is integrated vector management, which involves removing the breeding sites, reducing the vector density, and minimize individual exposures. And surveillance should be continued for the evaluation. And in Pakistan, the first epidemic was in 2006. Since 2010, Pakistan has experienced an epidemic of dengue in Punjab, Khyber Pakhtunkhwa, and Sindh. Any question from the class?
Thank you.